Mr. Jones. My name is Angelica. I'm gonna be taking care of you today. I was wanting to see if it's okay with you if I check for your lung sounds, just so I can make sure that I can suction you if needed. Is that okay? Okay, thank you. Can I please have your full name and date of birth? Okay, thank you. Now I'm just gonna auscultate and listen to you. Okay, I do have to suction you. Um, this procedure is going to feel like you're short of breath. It might cause you to cough, but the feeling won't be that long. It should be brief, if that's okay. Is that okay if I do that? Okay, thank you. I'm going to go ahead and start setting up. Do hand hygiene. The suction, I want it to be at 80 to 120 when occluded, and it looks good. And Mr. Jones, I'm just gonna sit you up just a little bit, and the patient should be at a semi-Fowler position unless contraindicated. And at this point, I am hyperoxygenating the patient to 100. They should have a telemetry monitor or an O2 pulse ox on, just so you can be able to assess the heart rate and the O2 while you're suctioning. Okay, and I've washed my hands. Now I'm going to set up my sterile field here. I'm gonna take this little thing. This is where the normal saline will go. Now I'm breaking sterile field because these gloves are a little bit sweaty. So if that were to happen in real life, I would hopefully not be in this situation, but I would also restart as soon as I saw that I broke sterile field. I'd dump this kit and go get a new one. So for the purpose of time in this video, I know I broke sterility. Okay, so the normal saline would have already been open. I would dump it in here. And I get my suction catheter out and I dump this. At this point, I know that my right hand will be my clean hand and my left hand will be as my dirty hand. I'm going to go ahead and connect it to the suction. Now, I'm going to insert the catheter in for no longer than 10 to 15 seconds. Whenever I insert it, I want to go straight in without occluding the suction. And again, I'm going to go in until I meet resistance. And then now I'm going to twirl it out while I'm suctioning. And we're going to hyperoxygenate. We're going to clean in the normal saline. We're going to remove the oxygen. We'll go in for our second pass. We're going to occlude the suction and twirl out. reoxygenate. We're gonna go into our normal saline, clean it out, and then this is gonna be our third pass. Like I stated before, we would have a telemonitor or an O2 pulse ox so we can assess Mr. Jones' heart rate and O2 status while we're suctioning. And we're gonna twirl out. And right now, I'm just pushing the inner cannula in. Technically, that's breaking sterility, but it's because it keeps wanting to come out when I pull the catheter out. So I'm done. Well, I'm not done with suctioning the patient. At this point, I would remove the dressing, discard that, hyperoxygenate again. I'm cleaning. Then if Mr. Jones had anything in his oral cavity, I would go ahead and suction his mouth. Then I would perform oral care. Now I'm good to go ahead and discard all of my things. Okay, I'm going to perform hand hygiene. And I'm going to reassess Mr. Jones' lung sounds, just to make sure that the procedure was effective. Okay. All right, Mr. Jones, now it was effective. Now I'm going to go ahead and do a new dressing change. So I've washed my hands again, performed hand hygiene. Now I'm setting up my new sterile field with my tray right here. And I don't know if it looks like I broke sterile field again, but I'm within my 1-inch border. And again, like I said earlier, it's hard to not have these gloves not be sweaty from retry. So at this point, I would cancel what I'm doing, go get a new kit because I broke sterility. But we're gonna pretend that did not happen. So we're gonna discard of our trash. We're gonna set up our sterile field. We have our ties, our straw. We have some Q-tips here. Here we have our trach dressing and a few pieces of gauze. And like earlier, my right hand is my clean hand, left hand is my dirty hand. I would take my normal saline and put it into two compartments of this tray. Mr. Jones has been hyperoxygenated to 100. We're gonna remove the oxygen. We're gonna remove the inner cannula, and we're going to let it soak in that normal saline. Then we're gonna take it out. And I know it probably looks like I broke sterile field there, but I promise you I did not. The tray was close to touching my sterile field, but it hasn't. Then I'm going to insert my straw here or brush, and I'm gonna scrub the inside. We're gonna discard. Now I'm gonna take these little things and I'm going to make sure that I clean the inside of this inner cannula or dry it off completely. I'm going to do that one more time. Okay, and then I'm going to take a gauze and I'm going to dry the outside out. Here, we're going to place this back in at an angle. Then I'm going to go ahead and take one Q-tip and I'm going to lift the tracheal plate and I'm going to clean around the right side of the stoma. And while I'm doing that, I'm going to be assessing the stoma and the skin surrounding. Put it into the normal saline. I'm going to lift and clean on the left side of the tracheal plate. We'll go again on each side. This time we'll do the tracheal plate. Then the next side. I did touch the tracheal ties, but we're going to pretend that did not happen. And now the tracheal ties, they are okay, so we're not going to mess with that. I'm going to lift the tracheal plate and kind of clean and dry off where I can without breaking sterility. Oh, and I just went below my waist. Again, broke sterility, but I would discard everything and continue. Or get a new kit and then continue. Now we're gonna place a new dressing. And our last Q-tip, we're gonna use this to assist us with putting the dressing back in place. That's good. And we're gonna put the oxygen back on Mr. Jones. Then we're gonna get rid of our trash. And we're gonna perform hand hygiene. We're gonna make sure with Mr. Jones if he is comfortable or if he needs anything. Everything looks good now. Now I'm gonna document the amount of sputum that was suctioned, the character of it, what the stoma and the skin around it looked like, and and Mr. Jones' reaction to the procedure. Now that I've cleaned everything up, I'm all done. And like I said, I'll just get Mr. Jones comfortable and put our bedroll up and go document.